The purpose of this video is to describe the operative standards for cancer surgery, the rationale for their incorporation into the Commission on Cancer's accreditation standards, and compliance requirements for the current CoC operative standards. The American College of Surgeons Cancer Research Program developed the operative standards for cancer surgery manuals to offer concrete, evidence-based recommendations on intraoperative cancer surgery techniques, where none previously existed. Published in 2015, 2018, and 2022, Operative Standards for Cancer Surgery Volumes 1, 2, and 3 cover standards for 15 disease sites. Volume 1 provides standards for the conduct of breast, lung, pancreas, and colon cancer operations. Volume 2 covers esophagus, melanoma, rectum, stomach, and thyroid cancer procedures. Lastly, Volume 3 includes sarcoma, adrenal, neuroendocrine, urothelial, hepatobiliary, and peritoneal malignancies. Each manual details the critical elements of oncologic operations to ensure optimal patient outcomes. Each critical element includes a recommendation for the conduct of the operation as well as an analysis of the data used to generate that recommendation. There is a growing body of evidence which describes the adherence to operative standards indicated in these manuals is associated with improved oncologic outcomes. In a study reported in the Journal of Surgical Oncology in 2019, various subsets of breast cancer patients were stratified into groups based on whether their operations were conducted in a manner consistent with the standards described in these manuals. These standards included margin-negative resection, number of lymph nodes examined, and the proper use of adjuvant therapy. As demonstrated by these survival curves, each subgroup evaluated patients whose operations were adherent to the described standards lived significantly longer than those patients whose operations did not adhere to these standards. In a similar study of gastric cancer patients whose operations were adherent to the described standards, which for this analysis included R0 resection and at least 16 lymph nodes examined, lived significantly longer than patients whose operations did not adhere to these standards. Taken together, this data demonstrates that adherence to the operative standards described in the Operative Standards for Cancer Surgery manuals may indeed lead to improved oncologic outcomes in the form of prolonged survival. QR codes to both studies are available here. Beginning in 2020, select recommendations from the Operative Standards for Cancer Surgery manuals were integrated into the current Commission on Cancer's accreditation standards. Also in 2020, the Cancer Surgery Standards Program was created to develop additional surgical standards, create resources and tools that support implementation and adherence to the CoC standards. Incorporation of the Operative Standards for Cancer Surgery recommendations as CoC accreditation standards was a step forward towards improving oncologic outcomes by reducing the variation in the way cancer operations are performed and documented across the United States. CoC Operative Standards 5.3 through 5.8 were applied to various procedures including sentinel node biopsy for breast cancer, axillary lymph node dissection for breast cancer, wide local excision for primary cutaneous melanoma, colon resection, total mesorectal excision, and pulmonary resection. In order for a program to be found compliant with the CoC operative standards, the program must demonstrate compliance with the entire standard as outlined in the measure of compliance. Each standard has technical and synoptic documentation requirements. The technical requirements differ for each standard and outline the intraoperative requirements for each standard. Those requirements are listed on the left. The documentation requirements dictate the required elements and responses are included in synoptic format. Those requirements are listed on the right. Synoptic format, as defined by the Commission on Cancer, is a structured format that includes all of the following. All core elements must be reported, whether applicable or not. All core elements are reported in a diagnostic parameter pair format, in other words, data element followed by its response. Each diagnostic parameter pair must be listed on a separate line or in tabular format to achieve visual separation, and all core elements must be listed together in one location in the pathology or operative report. To meet documentation requirements, Commission on Cancer accredited programs may opt to create institutional templates in-house or work with vendors to integrate their solutions for synaptic operative reporting. Multiple vendors have licensed content from the American College of Surgeons. It is expected that their electronic synaptic reporting solutions will allow CoC accredited cancer programs to meet compliance with the CoC Operative Standards. Select vendors offer comprehensive and customizable synaptic reporting tools that were built based on the content in the Protocols for Cancer Surgery documentation developed by the Cancer Surgery Standards program and are designed to replace traditional narrative reports and integrate into the electronic medical record. These companies are not owned or affiliated by the American College of Surgeons. Demonstrating compliance with the CoC Operative Standards and other accreditation standards helps to raise the bar for cancer care across the country. CoC accredited programs can proudly demonstrate to their communities, providers, payers, and the government that they have invested in systems aimed towards cancer patients receiving high-quality, coordinated care, and that they have made efforts for supportive services and resources addressing the full continuum of care available in their communities. Please feel free to contact CSSP at fax.org for any questions pertaining to the CoC Operative Standards 5.3 through 5.8. Thank you.